My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Today on the Expect Miracles podcast, we have Dr. Brad Maestas out of Albuquerque, New Mexico. Dr. Brad is a chiropractor with a specialty in sports medicine and is one of the chiropractors for the University of New Mexico. Dr. Brad uses an acupuncture technique called cupping to help his athletes recover and heal through old injuries faster than expected. He also uses RockTape, or some people might know it as Kinesio Taping, to help create more blood flow and heal musculoskeletal injuries. And on top of all that, Dr. Brad is a phenomenal chiropractor, so you really get a phenomenal treatment base that addresses all of your musculoskeletal injuries and conditions while seeing Dr. Brad. So without further ado, please welcome a good friend of mine, Dr. Brad. All right. Today on the podcast, we have Dr. Bradley Maestas. He is a chiropractor and does a lot of soft tissue work and trains with a lot of athletes at the University of New Mexico. Really talented doctor. He was one of my first friends in chiropractic school, and it's an honor to call him a good friend and a fellow chiropractor. Brad, how are you doing?
I'm good. Thanks for having me. Appreciate it.
Absolutely. Now, Brad, where are you from originally?
I was born and raised in Albuquerque, New Mexico.
Beautiful. And what was that like?
There's not as much to do. It's not like California where there's a lot of entertaining.
Yeah? What'd you do for fun growing up?
A lot of outdoors and sports. That was my whole life. Do a lot of fishing, hunting, and then, of course, I played football, wrestled, and then I did track and field. So
nice. I actually wanted to ask you this. You did a lot of hunting growing up, right?
Yeah.
What did you used to hunt for?
Elk, deer, kind of a little bit of everything.
That's beautiful. So is there like a certain connection that you have with the food that you actually hunt? You bring it back to the table? Because that's like pure organic meat that you're eating there. What is that like eating that stuff?
You know what? It makes your body feel clean, for one. Just because, first of all, your mind knows this came from the wilderness. It's not store-bought. It's not force-fed anything. 2, elk meat, one of the highest protein red meats you can get.
Really?
It's up there. So stuff like that, it's clean and really good for your body. Low fat content, all that stuff just makes you feel clean inside.
So like, after you eat like a big steak and everything, you feel like it sits in your stomach just forever. You don't get that feeling when you're eating elk and stuff you bring home hunting?
I mean, if you eat enough, yeah. But no, I never really feel like bogged down or greasy from eating it. I'll take it to the butcher and he'll make me breakfast sausage out of elk and deer. And so you kind of can eat it in every meal. And it's not just eating the same stuff, which is really nice.
Beautiful. And so what sports were you into growing up, Brad?
My main one was football, of course. That was my big one. But most people don't know, I actually went to the University of New Mexico and started with track and field. I threw the hammer and discus.
Wow.
Yeah.
So that's what you were recruited for?
Yeah, that's what I was recruited for. And then football offered me a scholarship to switch over, and that's when I started playing football again.
Wow, that's pretty amazing. When did you discover you had a talent for throwing the discus?
That was actually in high school.
Yeah?
My track coach I started with the javelin, but I ended up tearing my rotator cuff wrestling.
Oh, really?
So the discus ended up becoming a better option for me to throw because javelin's kind of like throwing a baseball.
Yeah. And so were you just naturally gifted at it in the beginning, or?
No, I was awful. I was terrible. So hammer's an event that you can't do in high school. So it's something that a lot of people don't do until college. And I did it at what was called the Southwest Games. Mm-hmm. And the first time I ever did it, coach saw me do it and saw that I had potential. That was what I was actually gifted at.
Wow.
It wasn't so much the discus.
So did you play football in high school, or is that something you just picked up?
I played high school since I was 12.
Gotcha.
Always a lineman. I mean, you know me.
Yeah.
6'5",
Yeah.
270.
Exactly. Brad's a big boy.
I'm a big guy. So I played all the way through high school. I didn't play in college until my last 2 years of eligibility. And that's actually how I got into chiropractic.
Really? Why is that?
Tore my ACL, MCL, meniscus, and they started getting me adjusted because my hips were off from being, when you're in that leg cast for 3 to 4 months,
Yeah,
it really messes up your low back and everything.
definitely. So what was chiropractic able to do for you?
So when I first started doing rehab, they don't let you do lateral mobility. You know this. So
Yeah.
you slowly start getting it. Well, when I started being able to start to run again, I just always felt like something's off. And so the chiropractor started coming in, and he actually started working, doing all the muscle myofascial work on top of adjusting my sacroiliac joint. And I noticed a huge change in just feeling power and like I could actually run without hesitation.
And was this relatively new to you? Did you ever go to the chiropractor before?
I hadn't. That was my first.
And so after getting chiropractic care and it really helping out your leg, you're like, this is what I need to do?
Yeah. I was originally looking into going into cardiology school.
Really? That's an interesting field to choose. Why'd you choose that?
I've always just been fascinated with the body. And I know a lot of people that have heart issues. So that was I want to learn more about this.
That's funny you say that, because I remember having one of those classes where we were reading the cardiograms and everything, and you were just like glued to it. Like you were like going in depth. Everybody was done, and you were like, guys, check this out. Look at this. We're like, you had like a fascination with it. That's funny.
Yeah.
That makes sense now.
You always find that one thing that you're like, that's just interests you, you know?
Yeah, definitely.
And that's kind of what led me into all the myofascial work as well. Because then you start learning about the heart muscle, and then you kind of go, the heart's just a giant muscle. And then I was like, well, what's the rest of the body need? Yeah, it's just kind of snowballed to where I am now.
So Brad, what are you doing now? Like what are the types of patients you see? Are you working with mostly athletes? Do you have like a family practice too, or is it strictly athletes?
It's a mix. It's a family practice, but I do see a high volume of athletes. So right now, actually where I'm talking to you from is inside of a mixed martial arts gym.
Nice.
I'm here 2 days a week. And so I see a lot of their athletes. But then we have a lot of people that come in and just learn how to do boxing, their Muay Thai, and they will come see me here as well. So I have that aspect. The other office is where the UNM will send their athletes if they need it. We also have the triathletes, like I was telling you. See a lot of, that's where the family wellness kind of comes into play.
Yeah.
And we're actually moving into a bigger office here so we can do more physical therapy as well in there.
So Brad, what are you doing with these athletes?
A little bit of everything. So first time they come in, it depends on what they need. If it's a fighter, like a fighter where I have to get them better in a week, I'll usually go straight to doing like moving cupping, put a cup on them, and then we move it. But I always go along the strands of the muscle.
Can you just go briefly, what is cupping? Did that start with acupuncture?
Yeah, it did. Cupping is originally an acupuncturist type of medicine, right? And so what it is you take a cup and you suction it to the body. And there's multiple ways of doing it. There's little silicone cups that kind of like those old finger poppers will suck to your skin. The vacuum ones, which is what I use more. And then there's the fire cupping where you light a cotton swab, put it inside the cup until the oxygen's gone, and then you can stick to the body.
So what are the medical benefits of cupping?
So for me, the most fascinating part is if I do stagnant cupping, you'll see the spots of inflammation. Like you know where there's been a chronic injury because that cup will turn dark. I never leave them on more than a minute.
Wow.
It takes maybe 30 to 45 seconds for that cup to turn dark if it's going to.
Wow.
The cup right next to it might not change at all. So that tells me that your blood flow has not been circulating correctly in that area compared to the rest. What is that inflammation is being pulled towards the surface. So now you got to think all that new blood flow, the protein, the carbs, everything that you need to make your muscles heal gets put back in there.
Now, does that help you out chiropractically as well, of knowing where to like pinpoint where to start looking of any subluxations or anything out of place?
Not necessarily. I always, hands are first.
Right.
I will go through and I'll feel kind of what's going on.
Mm-hmm.
But once I figure out like, hey, this person's T4 rib is subluxated on the right, I'll go through and put those cups along the intercostals above and below. That brings all the blood flow in there so they relax. They're
Gotcha.
not constant spasm. So when you adjust, instead of doing that hard, forceful adjustment, it just nice and easy.
So it
Goes right
brings the blood flow back to the area, decreases inflammation. Anything else it's doing for you?
Not really. I mean, it depends on how I'm doing it. I'll also do it with motion. So
Oh, that's awesome. That's good.
when I have somebody with a rotator cuff, their whole back will be covered in cups. And then I'll make them go through every range of motion for the rotator cuff. So you're talking your supraspinatus, region behind the back, going across the body.
So that's kind of like ART with like cupping, right?
Exactly.
That's
exactly
really cool.
And I even have cups now that have a little pressure point in the center of them. So you kind of get that acupressure. So it's lifting the skin into that point to get that trigger point release as well.
Now you see after your cupping, they have huge people can have like marks on their body. Does it hurt? What does that feel like?
Most people don't even notice them.
Really?
They'll have no idea until you show them. You're like, look, this is what's going on. But it's usually not tender. That's where stuff like my RockTape comes in handy.
Ooh, so please talk about RockTape. What is RockTape? I know there's a couple different. There's Kinesio Tape. There's RockTape. Yeah. I haven't had anybody touch on this yet, so please just go into the benefits of RockTape and Kinesio Taping and all that stuff.
The benefits are endless, basically. So big one for me is they have a lymphatic drainage tape, and it kind of looks like fingers, right? And you overlap them, and it'll decrease the time it takes for your bruise to heal in half, if not faster than that.
The rock taping?
The rock taping, yeah. And so that's how I kind of use it in conjunction with cupping, is I'll put it over the cut marks, and those heal up fast, because what it does is it's got rubber inlaid in the elasticity of it that lifts the skin. So you're getting that constant relief, so blood's able to move and kind of circulate much faster than it would if you didn't. And then you also have all your supportive stuff. So kinesiology tape, that's a big thing, is everyone thinks, oh, I don't want tape because it's going to restrict me. KT tape, RockTape, all that tape, it moves with you. So it's not a restrictive tape. It's not something that I'm going to tape your knee and I'm telling you, oh, don't worry, your ACL is supported. It's not like that. It's facilitating muscles and everything else too. So you're getting that proprioceptive reaction. So everything's preemptively firing. So that way you're less likely to have the injury, but it also is going to give you the benefits of getting that blood to heal yourself.
So do you encourage your athletes to use it while they're playing their sport, or do you tell them, wear this for a couple of days and take it off when you're playing?
It depends on what they're doing. If they've been training with the rock, so if we've been treating the shoulder and I've been taping it up while they've been practicing, I'll make them play with it taped because they're used to having it. And I don't want to change the way that they've been functioning in a competition as the way they've been practicing. So it all kind of depends. Now, if I only have them wear tape for 2 days and then they have a couple of days of practice and then game, I won't let them tape for the game because I want them to stay in that function of what they've been practicing.
And how long does the tape last for? I'm sure it varies per patient and what they're doing, but how long can it last for?
Different brands are different. That's the main reason I use RockTape is they have an H2O brand, which they use with their swimmers. And I will put that on patients and they can have it up to 2 weeks.
Wow.
Without cleaning or anything. I mean, that's with them showering, everything. So it all kind of depends on your body as well. If you're somebody that has a high oily kind of sweat, it's going to peel faster than somebody that doesn't. But because it's also like a fabric material, it breathes. So it's not going to just let that sweat sit underneath it, which is nice.
So you see it restoring blood flow, restoring movement, healing up injuries faster. Anything else you see?
That's pretty much the two major components for that on my aspect of it.
What about posturally? What if someone just got bad posture? Can you put that on them to kind of train them, to remind them that, stay straight?
100%. I don't do that as much, but do you remember going to like seminars and you see those postural shirts?
Right, yeah.
That have like the weird stripes all over them?
Yeah.
You can do that same stuff with this.
Gotcha.
It's all fascial training. So if you ever get the book about your fascial trains, anatomy trains, best thing ever.
Yeah.
I mean, it is incredible. And then if you tape along those fascial trains, you'll see people automatically, their posture will just facilitate to go back to normal.
Yeah. Now, Brad, I got a question for you. So when you're at your regular chiropractic, I mean, pretty standard to see patients X amount of times a week, depending on their condition. But you have people that come into you that are like, listen, I'm playing Friday. You got to get me better.
Yeah.
How does that work?
It depends on the circumstance. I mean, basically, I'm giving them, we're doing all the muscle therapy. So whether I'm doing percussion therapy with the Theragun or the Hypervolt, or we're doing cupping or something, I've got to get those muscles functioning again. Otherwise, I'm going to have to tell them, like, no, you can't play.
Right.
But most of my athletes, they're going to do it whether I tell them.
Yeah, that's the tough part.
My whole goal is if I can get them functioning, every time they come in, I'm trying to drop them down from where they were by 50%.
Mm-hmm.
So they should be 50% better every time they leave my office.
So do you have to see some of these people twice a day? If it's like crunch time?
If it's crunch time, usually not. So most I've seen someone is 3 times a week.
Mm-hmm.
And it's not even adjusting every time. Sometimes I'm just doing the muscle therapy. We're just going through and we're releasing your fascia. We're going through, depending on what you need. Maybe I'll put them on a decompression table, or we'll put them up to the leg compression sleeves and let blood flow kind of get forced out and back in. I always see chiropractic as more than just an adjustment, you know?
Yeah, absolutely.
It's our duty to do more than just. I mean, with athletes, they don't like to be over-adjusted. That's a big thing. They don't like feeling like they're being overworked when it comes to their spine. So you have to take a different course with them as opposed to your average patient where you're like, look, your occiput C1 every 3 to 4 days is wanting to lock up. We're working on why it is, but we need to keep releasing it. Your athlete's going to be like, well, leave it because I've been practicing with it. I need it. It's a tough thing to kind of gentle, fine line of what you're able to do and what you should be doing.
Do you ever find yourself having to change the athlete's ergonomics? Like say they're a lineman like you were and they have this constant injury, like the way they're standing when they're playing. Do you ever have to go into that field to make sure they're not injuring themselves the way they're standing or they're playing? Or
actually, yeah, I do that a lot. So being a former lineman, I know, especially I was defense, so we always go up against offense guys, right? You never really see yourself unless you're watching film, but you always see that offensive lineman. So I know when an offensive lineman comes in my office, like, hey, my hip's hurting. I know exactly already why.
Yeah.
But I make them go, I'm like, show me your position. Let's see how you do this, just to prove that I already knew. But most of the time, it's all positioning. They leaned wrong, they twisted, they leaned this way, instead of keeping the position that they're supposed to and are taught to. They gave out that one time.
Now, Brad, the sports medicine field is constantly being updated with new technology and equipment to heal people. Do you see anything out now that you're dying to get into and test out, or anything new, or you're pretty happy with the tools you got now?
You know, there's a lot of tools that I would love to have.
Yeah.
Once my practice is up and like really moving, there's stuff like the Tecker.
Tecker?
Yeah.
What's that?
Best way to explain it, it's almost like ultrasound, but intensified.
Okay.
So it's reducing like fracture healing time.
Really?
Yeah. The machine is incredible. And the first time I saw it was with Dr. Kessler and Tustin.
Okay.
He's also known as the OC Fight Doc, which is how I got into MMA. But he was using it. I've been watching it, kind of the research grow on it and everything. Now it's becoming a little bit more popular. That's in the machine that if I could get my hands on it, that's
I'm sure they're pretty expensive, right?
Yeah, they're very expensive.
Do they have any laser therapy or anything at the facility you're at, or even at the university?
We don't really use so much the laser therapy. Something I'm looking into doing is doing my dry needling certification.
Oh, cool. I hear that gets great results.
It does, and people absolutely love it, whether they're athletes or not. And so that's something that the doctor I work with in my other office does all the time. So he's been telling me, like, I need to go get the class.
That's awesome.
So once I can have that free time and get kind of up and going, I'm going to be getting that.
Beautiful. So football season's starting up. You're going to be a pretty busy guy in these next couple months, right?
Yeah. Believe it or not, track season is busier than football season.
Really?
Yeah. A lot more of athletes come in saying they pulled their hamstring. I tweaked my hip flexor. Football, I guess football is usually the sport where unless something's really hurt.
Yeah, those guys are pushing through it.
Yeah, they're going to push through it until the end. And then as soon as football season ends, I'll start for a month or two where they're just coming in one after the other.
Yeah. So, Brad, where are you located? Where can people find you and come in and see you?
So Monday, Wednesday, Fridays, I'm located with Spiegel Sport and Spine. Most people around town actually know Dr. Spiegel. Played for UNM as well. And then he actually ended up going and playing for the Browns. So a lot of people know who he is. And then I'm at Latrell Yee MMA Gym Tuesdays and Thursdays.
Beautiful. You have a website too?
We're working on the website now.
Perfect.
The best way to contact me is actually going through social media. Facebook, Instagram. I have all my links to how to book online.
Perfect.
So you don't have to call me to book an appointment, which is awesome.
What's your Instagram handle?
BM Cairo ABQ.
Beautiful. And Brad, if there's one piece of advice you can gift the audience that you've taken with over the years that really resonated with you, could be absolutely anything, what would it be?
Honestly, take care of your body.
Beautiful.
Don't wait until there's an injury. If you start now, it's preventative. It's going to make you last longer as opposed to fixing it when it's broken and then we're having to fix something. That's my go-to for everyone.
Oh, yeah, I'm sure you learned that the hard way too.
Take it from me. I've learned from my experience.
All right. Well, Brad, thank you so much for coming on. Seems like you got something really amazing over there in New Mexico. Happy for you. And I'd love to have you on anytime again.
I appreciate it. Yeah, anytime you just let me know. I'm always good down to talk to you.
All right, brother. It was good catching up with you. I'll talk to you soon.
Sounds good. Have a good one.
Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com, drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.